Welcome to my channel Natural Cures. Diverticulitis is inflammation or infection of one or more balloon-like cysts, diverticula. Diverticulitis usually affects the colon. Pain in the lower left part of the abdomen, pain on palpation, and fever are typical symptoms of diverticulitis. The diagnosis is based on the results of a CT scan that is confirmed later with a colonoscopy. People with mild symptoms of diverticulitis are treated with rest, a liquid diet, and oral antibiotics often, while people with severe symptoms are treated in the hospital, where they are treated with intravenous antibiotics and sometimes surgery. Diverticulitis occurs in people who have diverticulosis. This disorder occurs when a small hole in the diverticulum allows gut bacteria to spread. Diverticulitis is most common in the sigmoid colon, which is the last part of the large intestine just before the rectum. Diverticulitis is most common in people over the age of 40. The infection can be severe in people of any age, but it is more dangerous in the elderly, especially those who use corticosteroids or other drugs that suppress the immune system and thus increase the risk of infection, including colon infection. The proportion of men younger than 50 who must undergo surgery to treat diverticulitis is 3 times greater than the proportion of women, 3 to 1. The proportion of women over the age of 70 who must undergo surgery to treat diverticulitis is 3 times greater than the proportion of men, 3 to 1. Symptoms of diverticulitis. Diverticulitis usually causes pain or tenderness on palpation, usually in the lower left part of the abdomen, and fever. Unlike diverticulitis, diverticulitis does not usually cause bleeding in the digestive system. Diverticulitis. Diverticulitis. Image provided by David N. Martin, MD. Complications of diverticulitis. Inflammation of the intestine may lead to the development of fistulas, abnormal channels, that connect the large intestine to other organs. A fistula usually forms when the diverticulum in the large intestine touches another organ, such as the bladder, and the diverticulum ruptures. Inflammation products, along with the bacterial content of the large intestine, slowly leak into the adjacent organ, causing a fistula to form. Most fistulas form between the sigmoid colon and the bladder. These fistulas are more common in men than women, although women who have had a hysterectomy are at greater risk from the absence of the uterus that separates the large intestine from the bladder. When a fistula forms between the large intestine and the bladder, the contents of the intestine, including normal bacteria, enter the bladder, causing urinary tract infections. Less commonly, a fistula can form between the large intestine and small intestine, uterus, vagina, abdominal wall, or even the groin. Complications of diverticular disease. In people with diverticular disease, bleeding from the diverticulum into the intestine can occur. Ruptured diverticula causes intestinal contents, including germs and blood, to leak into the abdominal cavity, often resulting in infection. An abnormal channel, fistula, may form between the large intestine and another organ when there is a tear in the diverticulum that is touching the other organ. Complications of diverticular disease. Other potential complications of diverticulitis include inflammation of nearby organs, such as the uterus, bladder, or other parts of the digestive system, a tear in the diverticulum wall, an abscess, a pocket of pus, and infection of the lining of the abdominal cavity, peritonitis. Repeated episodes of diverticulitis can lead to bowel obstruction because the resulting scarring and muscle thickening may narrow the lumen of the large intestine, preventing the passage of solid stools through them. Diverticulitis is diagnosed. A doctor may completely base the diagnosis of diverticulitis on the symptoms if he knows the presence of diverticulitis. However, many other conditions that can affect the large intestine and other organs in the abdomen and pelvis may cause symptoms similar to diverticulitis, including appendicitis, colon or ovarian cancer, an abscess, and non-cancerous, benign, growths on the uterine wall, uterine fibroids. A CT scan of the abdomen may help determine the cause of the problem with diverticulitis, not appendicitis or an abscess. Once the inflammation has cleared or the infection is treated, The doctor performs a colonoscopy, examining the large intestine using a flexible viewing tube, or making an X-ray after the rectal injection of barium. These tests are done to confirm the presence and assessment of the severity of diverticula and to rule out colon cancer. It is usually necessary to postpone a colonoscopy or an X-ray after a rectal injection of barium for several weeks after treatment, usually because it may damage or rupture the inflamed intestine. One of the rare conditions is exploratory surgery to confirm the diagnosis. Treating diverticulitis. Mild diverticulitis can be treated at home with rest, a liquid diet, and an oral antibiotic, such as ciprofloxacin. Diverticulitis symptoms usually decrease quickly. Some people may not need to take antibiotics when treating diverticulitis. After a few days, people can start a soft, low-fiber diet for 4 to 6 weeks. After 6 to 8 weeks, people may have a colonoscopy or a rectal barium injection to evaluate the colon. You can start following a high-fiber diet after 1 month. People who suffer from more severe symptoms of diverticulitis, such as abdominal pain and high temperature of the body above 101 degrees Fahrenheit, 38.3 degrees Celsius, and poor response to the use of antibiotics by mouth, and other evidence of the existence of cases of infection or complications has been admitted to the hospital. In the hospital, a person receives fluids and antibiotics intravenously while remaining on bed rest and not taking anything by mouth until the symptoms have passed. Non-surgical treatments can be used in about 80% of people with diverticulitis. The abscess is drained through a needle inserted through the skin and guided using a CT scan. If drainage of the abscess is helpful, people should stay in the hospital until symptoms disappear and follow a lax diet. Surgery to treat diverticulitis. Emergency surgery is necessary for people who have had a tear in the intestine or with peritonitis, and for people who have severe symptoms of severe diverticulitis that do not respond to non-surgical treatment within 48 hours. People who have increased pain, palpation, and fever also need surgical treatment. Ruptured intestine always causes an infection in the abdominal cavity. The surgeon removes the torn portion of the intestine. The ends are then reattached directly in healthy people who do not have a rupture, abscess, or severe intestinal inflammation. Other people need a temporary colostomy. See figure, understanding a colostomy. A colostomy is an opening between the large intestine and the surface of the skin. After about 10-12 weeks, or sometimes more, have passed after the inflammation has subsided and the person's condition has improved, the severed ends of the intestine are reattached through sequential operations and the colostomy is closed. Fistula treatment involves removing the section of the large intestine where the fistula began, reattaching the severed ends of the large intestine, and repairing the other affected area, for example, the bladder or small intestine. Please subscribe and likes and commenter.